Welcome to Coffee with the County. Today I am with Kelli Crowther, who is a registered public health nurse in our Health and Human Services office or department. Welcome, Kelli.
Thanks for having me.
Well, thanks for coming back again.
Yes.
This is so much fun having you in again to discuss some things and talk about some of the upcoming information that we're going to need to know on the move, the big HHS move. And I think, you've got some good information to share. But I do want to start with you. Where did you come from? How did you get to Aiken County and registered health nurse? Right?
Well, I have to say, I don't think I went very far. I'm actually a born and raised Aiken girl.
Awesome.
Graduated a Gobbler in 2004, left for college and came back. Yeah.
I love that story.
I worked at Riverwood Hospital for 10 years. Worked in many departments over there, and then I worked at the school for as the district nurse for Aiken Public Schools for 6 years.
Okay.
And then just transitioned to public health in January. So I've been here for about 7 months now.
So you found an opening over here, I think, when someone retired, right?
Yep, that was Liz Short. Liz Short was with the county for about 10 years. She did a lot in those 10 years and has some big shoes to fill. But I was really looking forward to coming over to public health. I know I worked a lot with them when I was at the school. Really liked the environment that they have and the teamwork that they have, and kind of felt like just coming home.
I know that they're happy to have you. I talked with Erin. She was pretty excited when this all came about. So it's good. Erin Mells is the big boss over there in public health, right?
She definitely is. She's a great boss, though.
You mentioned you've been here since January. You have a few programs. I'm sure Liz was responsible to run different programs throughout the county. Can you explain a little bit what programs you're responsible for and,
Sure.
and your expertise?
Yeah, definitely. So in public health, all of us have different programs that we run. So each of us coordinates those different programs, but some of us work together in multiple programs also. With the retirement of Liz, the public health group took that opportunity to kind of reassign some of those different groups. So I did take over some of the coordination of programs from Liz, including the WIC program, the peer breastfeeding program, and the opioid settlement program. There's also some that I took over, like early childhood screenings. I took over from Bria Hamdorf, and then I also took on the child and teen checkups from Stacy Durgan-Smith.
Because you kind of have a background in those kind of things, right? Is that?
Yeah, I definitely think that they took that advantage of me coming from the school and having a knowledge in those areas and those kids.
Yeah.
And saw that I could fit those shoes pretty well.
Well, knowing Erin and her expertise, I'm sure it was good to look at, okay, what can we do differently since we have some new people coming on, have the opportunities. So
yeah,
that's really cool to see.
Well, and in public health, actually, the programming changes quite frequently. So we kind of have to evolve as those changes happen. So we don't always have the same programs. Obviously, WIC has been something that's been around for a very long time. But even our family home visiting program, we still have home visiting, but even the program that runs it has changed, which is just some knowledge that I've started to understand since working at public health.
There's always changes in government somehow. You think government is just slow and steady and just but there's always changes that come up, and the community changes too, and we have to make sure that we're helping everyone. Yep. And supporting everyone in the community. You mentioned WIC, but before we get to that, the opioid settlement, I always have trouble saying that. There was a number of dollars that were given back by opioid companies for some of the whatever struggles that just like I think I remember cigarettes at that time. At one point, tobacco had to give back because it was harming the community.
Yep. And
kind of the same way the opioid settlement came through. There's a number of dollars that come back to the county.
Yes, that's correct. So it's a settlement. So it was actually kind of a national-based lawsuit, and then different states got to determine whether or not they wanted to be a part of that, and Minnesota did opt in. And from there, then different counties and groups like Native groups, things like that, got to opt into whether or not they wanted to be a part of this settlement. Aiken County is one of the counties that did opt in, and I think the majority probably did, but there are a few that did not. So yeah, that is something that is going to be bringing in over $2 million into the county for the purposes of education, harm reduction, everything that has to do with opioids though. So this is an ongoing lawsuit. So as different companies are becoming a part of this lawsuit, then more money, which is a very small percentage, but as you can hear, $2 million.
$2 million for Aiken County is a good step.
Yeah, and so that is where we were prior to now receiving this next level or this next set of funding. So it will be even more than that, which I don't know what that number is at this time.
Yeah, it's too early to tell on that one. But so you mentioned, the $2 million that's coming in. That's not just let's put it into our funds and take care of it in Aiken County. That goes right back to the community, correct?
Correct. Yep, that is actually just sitting in an account, and then we actually take on applications, which is part of my role as coordinator of that program. So I have nothing to do with the spending of the money. I bring the people together to kind of coordinate how that funding is spent. So we do have what we called is an opioid subcommittee, which is a group of community members that have given their time to be a part of this committee to determine where we would like to spend those dollars to benefit our community. And so we have had quite a few different applications that have moved through that funding process. And I feel like we have probably spent close to the $500,000 to $600,000 mark. I definitely could look that up, but I'm on the spot right now.
So spent that money, meaning you gave it out to different organizations or awarded different organizations funding to help support, educate, get back to health in the community. If there are people that are suffering from opioid addiction, this type of dollar will help that group, correct?
Absolutely. Actually, a fair amount of what has currently gone through has gone back into our school systems in Aiken County, all in McGregor, Hill City, and in Aiken, kind of for the education of the students and community in that area.
Yeah.
We've also brought in, I think, one speaker every year, which we do have a speaker coming into the schools this fall in October, and that will be for all of our schools. So they will start in Aiken on October 1st for our Aiken students, and then they will speak in Hill City and McGregor on October 2nd.
Yeah, it's amazing to hear. I've learned so much doing these and hearing what the county does to help and help support. And the one thing I learned in HHS so far, not one, but a thing, that education is as important as trying to eliminate something, because if you can educate at the beginning, you may not have the problem down the road, right?
You got it.
It's a long-term plan.
It's all about the prevention, the education to prevent it.
See, you guys have such the cool words over there. I can't ever find the right words, but you guys in HHS have it figured out.
As with many aspects of life, preventing things is a whole lot affordable, more effective, and all those different things. Once you get to the point of needing treatment where you need to go backwards from a problem, that becomes more difficult.
Yeah.
So definitely public health is on that prevention side, the education, the preventing people from getting into those places in which they need treatment-based programs.
Yeah, I think that's important to call out and give you guys that credit for of trying to take care of that on an education standpoint and prevention instead of treatment.
You got it.
I think you have both, right? Obviously you have both things, but to make sure that we're doing what we can for the new generations coming through and making sure they're protected from some of the stuff we didn't know maybe when we were younger, and just continue to try to help and support that community is awesome. Thank you for that.
And they say public health, when things are going well, you don't know that they exist because they're kind of on the back pages of things. They're in the prevention. You see them in the background.
Yeah.
You only see public health out on the forefront when you hit that treatment stage. Like in our COVID days a few years ago, when public health was at that forefront, but of course we were in a kind of a crisis mode then.
We needed you then, and they were there, which was great. One of the other things you mentioned was WIC, and I know that Sarah Pratt had just done a podcast letting everybody know that our HHS building is going to go through a remodel. I know you guys are all excited about that. And that our customer-facing or client-facing employees are going to relocate to the VFW. And we wanted to do a number of these podcasts letting everyone know where do some of the certain other groups go, what's happening with WIC, and I know that you wanted to tell everybody about the differences in the WIC program. Or changes in location, maybe. So
this summer has definitely brought a big transition, and especially we were talking within the first 7 months of my employment with the county. We're just rolling with this, but we are actually transitioning our WIC clinics out of the Health and Human Services building, and we have been accepted by First Lutheran Church. They have so graciously accepted our ask of hosting our WIC clinics in their space just during this remodel process. That clinic will be just for the appointments only, just as usual. So if you have a WIC appointment, that will be at First Lutheran Church. That is located in Southeast Aiken, 1 block east of Highway 169. So kind of down by the Rippleside Elementary School area.
Yeah. And for those of you that have been around for a while, the old Paulbeck's used to be very close to there, right?
Yeah. Yep. Now it's an antique store and O'Reilly's. Yeah.
There you go. See, times change, things change.
Yeah.
When does, and I know that the transition is coming soon, but when does the appointment start over at the church? Is that at beginning of September, the same as the remodel?
Yep. So the first group so we host Aiken clinics. It's the first 3 consecutive days in each month. So if the month were to start on a Wednesday, we would then have the clinics the following week, that first consecutive Tuesday, Wednesday, and Thursday. So that will be starting that first Tuesday, Wednesday, Thursday, right after Labor Day.
And that will move over, instead of coming to the HHS building, you move over to the church. And thank you to everyone who's helping community when we go through the remodel and doing those different things, and different organizations stepping up to help is awesome to hear.
And First Lutheran Church is a great space to introduce the community to if they're not familiar. They host many different community activities. They have our youth center there on some evenings throughout the week. They also have 2 community meals during the week, and they host our food shelf.
Yeah, they do a lot.
They do. So I think will be a great thing to kind of have that year to introduce people to, hopefully make that a familiar space. And hopefully it will bring people into First Lutheran Church even after we come back from the remodel.
Sure, I hope so. I hope we can help each other. And again, thank you to them for stepping up and doing that for us, and moving the WIC meetings, WIC clients, WIC appointments, all these HHS terms, clinics. I'll get them someday.
Yes.
The WIC appointments over to a different location. Again, starting in September. Go ahead, sorry.
Yep, but that is only for the people that are now on WIC. So if you are interested in applying for WIC, you can do that right online. If you just type in Minnesota WIC, you can definitely find the application. It's called a Red Cap survey. And if you just choose Aiken County as your location, that will come right to Aiken County Public Health. Don't feel like that's going to go to a state-based email or anything like that. That comes directly to us. You can also go to the VFW building, which is where the Health and Human Services office specialists will be, and that is also where you can go to apply for WIC. They can get you connected with public health from there.
It's not complicated at all if you just take a look at it and go through it. Pretty easy to apply for, pretty easy to get in touch with our Aiken County Public Health Department. Anything else you got coming up you want to bring up?
I don't think so, but one thing I wanted to mention, we've had a few local people that have either transitioned in or transitioned out of our WIC program, and I just want to give a shout out to our WIC team. So I might coordinate the program, but it's kind of a team approach with WIC. So we have 3 public health nurses, including myself, a dietitian, and our case aide that all work within WIC program. And we have gotten so many positive reviews from people that have utilized the WIC program, so I just want to give a shout out to the whole team. It's definitely not me doing all the work.
They owe you lunch for that, tell them.
I don't know about that.
That's one of the highlights of listening to these podcasts and doing these podcasts, is to find out the outstanding talent that we have at Aiken County. And that we put experts in the different areas and experts in the positions and rely on those experts to help the community, because that's what the government does. And it's really enlightening to see the talent that we have in our organization, you being one of our newer members, and thank you for doing that. And someday we'll have a retirement party for Kelli in Aiken County.
Yes.
Hopefully 30 years down the road. So thank you for coming in. Thank you for bringing the information in. And again, thank you for everything that you're doing for the community. We really appreciate it.
Yeah, I know there's a lot of people in Aiken County that have a passion for this community, and we're just here to help it grow and help it thrive. So. And
I love your story about going to college, going away, coming back. That is the perfect economic development story that I try to tell out there. Listen, we can get the kids coming back, and you're a perfect example of that. So thank you for that.
Yeah, family has a big part of that. My family has long-term been in this area, and family is huge to me. So
yeah, that's important.
So it draws people in.
That's it.
Community and family.
Community and family. You heard it right here from the experts. Thank you, Kelli, for coming in. And you're listening to Coffee with the County.